Syphilis develops in 4 stages. The 4 stages of syphilis are primary stage, secondary stage, latent phase, and tertiary phase. During the primary stage of syphilis, an infected person may notice a small sore called a chancre. The sore appears at the spot where the bacteria enter the body. Most infected people don't even notice the sore because the sore is painless, and sometimes they can be hitting, for example, in the rectum or between the butt cheeks. The chancre is very contagious, and the chancre will also go away in 3 to 6 weeks regardless of treatment. During the second or secondary stage of syphilis, an individual may notice flu-like symptoms such as fever, headache, sore throat. And another common symptom during the second phase is the appearance of the skin rashes, like the ones you see on the picture. Those rashes, they can be noticed on the individual's hands, back, or in the sole of their feet. And although they appear itchy, they're not itchy at all. And like the chancre on during the first phase that would disappear whether the person receives treatment or not, the symptoms during the second phase, they would disappear as well whether the person receives treatment or not. Latent phase of syphilis starts after phase 1 and phase 2 symptoms disappear. Usually during this phase, individuals have been infected for 1 year and symptoms are usually not present. The latent stage can last for years. Signs and symptoms may never return during this phase. However, if the individual goes untreated, they will advance to tertiary or advanced phase of syphilis. Untreated syphilis may cause dementia, nerve and liver problems, and in some cases the eyes gets affected, which can lead to blindness. Individuals' bones and joints can also be damaged by syphilis. And many of the symptoms above will usually appear after 10 to 20 years after the primary infection of syphilis. Now that you learned about the stages of syphilis, I'm going to talk about the modes of transmission. But how do people get syphilis? According to the American Sexual Health Association, syphilis can be transmitted through sex and or skin contact if sore or chancre is present. Transmission can also occur during a second phase if a healthy individual gets into contact with the rashes or skin lesions of an infected person. A pregnant mother can also pass syphilis to her offspring during pregnancy and or during childbirth. Syphilis is not passed through breast milk, but if the mother has a chancre on her breast or on her nipples, her offspring can get infected with syphilis as well. So in those cases, it's best if the mother doesn't breastfeed.